So the most common issue which most of the people suffer during summer season is heat stroke. What normally happens in a heat stroke is, normally there will be a thermoregulation mechanism in the body. But when body is exposed to extreme high temperatures, the thermoregulation is lost. Generally, when the temperatures reach like around 40 degrees centigrade, the normal thermoregulation of the body is lost. So prolonged exposure to these kinds of high temperatures leads to a condition called heat stroke. What are the symptoms which we see in the heat stroke are people generally suffer from heat exhaustion, and they may have a heat syncope. Like while doing the activity, the person may feel giddiness and he may fall down. The most symptoms which we see in these patients are the temperature of the patient will be high and the skin of the patient will be dry, and sometimes we can see rash and edema also in the patient. As soon as we see anyone who is suffering from heat stroke, we immediately have to shift them from a high grade temperature area to a low grade temperature area zone. Like if it happens on the road, we have to shift them under the shady area under the trees. We have to take help of the other people and elevate their limbs, especially the lower limbs like legs, so that the blood flow to the major organs in the abdomen and the brain is become normalized. If the patient is conscious, we have to ask them to encourage taking more amount of fluids. Like we have to ask them to drink normal simple water. The best is drinking ORS, but if it is not available, the normal water is also good. Avoid taking cool drinks, other carbonated beverages when you are suffering heat stroke. The other first aid treatment which we have to do is we have to cover the patient's body with cold compresses. Means we have to take something like ice packs or something nearby cold cloths, and we have to cover the patient's body so that we can reduce the core temperature. As soon as you see someone who is suffering from heat stroke, it's better you call an ambulance and immediately shift them to a nearby hospital. Prolonged exposure to the high temperatures and heat stroke can lead to multi-organ dysfunction and also sometimes leads to coma and death also. So it is not a small thing to avoid during the summer season. As soon as the patient is shifted to the hospital, we immediately try to rehydrate the patient with the fluids. Now let us discuss about what are the steps to prevent the heat stroke. So whenever you know that you are going to expose to the high temperatures for a long time, it's better for every 20 minutes you take a small break and move to a shady zone and drink like around 8 ounces of water to replenish the salt and water lost from the body due to the heat. The best home remedy for to prevent dehydration is it's better to take 1 liter of boiled and cool hot water and mix 1 spoon of sugar and along with a pinch of salt and drink this water regularly. The best thing to do is get a WHO recommended ORS sachet, which is like around 21 grams, and mix it around 1 liter of boiled and cold water and drink regularly, so that we can prevent the salt and water loss from the body. And other measures which we have to take while going in the sunny environment is using sunglasses, using caps and umbrellas to protect ourselves from the high temperatures. And most of the people who are vulnerable to this heat stroke are elderly people and children. So kindly avoid children and elderly people going out during the summer season. By taking all these precautions, all of us can protect ourselves from the heat stroke. Thank you.